Many people who never experienced school caning often wonder what it actually felt like. Those who lived through it frequently agree on one point: it is extremely difficult to describe accurately. The sensation combines anticipation, shock, pain, and emotional tension in a way that words struggle to capture. Historically, school canes varied in size depending on the age of the pupil and the institution. A typical cane for younger teenagers might have been a rattan cane, approximately 70 centimeters long and 10 millimeters thick. Larger or older pupils were often subjected to heavier canes. The flexibility, weight, and condition of the cane all influenced the severity of the punishment. The position adopted for punishment was also significant. A pupil bending deeply forward presented a thinner layer of flesh over the buttocks, increasing the impact and discomfort of each stroke. Even small differences in posture could noticeably affect the intensity of the punishment. Former pupils often recall that the pain of the cane was both sharp and immediate. The first stroke typically came as a shock, producing an intense stinging sensation that spread rapidly across the affected area. Subsequent strokes could become increasingly painful as the skin became sensitized. While the worst of the pain usually subsided within minutes, soreness and visible marks could remain for hours or even days. Many adults who later sought to recreate the experience discovered that it did not always feel as severe as they had expected. One reason may be physical differences between adults and school-aged children. Adults generally have larger, better padded buttocks, which can absorb more of the impact. As a result, the same cane and technique may produce a less intense effect than it would have on a younger person. Psychology also played an important role. Schoolboys receiving punishment had no choice in the matter and often faced considerable anxiety beforehand. The knowledge that the punishment was unavoidable frequently heightened the experience. Adults voluntarily seeking a similar experience do so in a completely different frame of mind, which can alter their perception of the pain. Accounts from former pupils vary considerably. Some remember canings as moments of sheer agony that served as a powerful deterrent against future misbehavior. Others recall enduring the punishment with determination, regarding it as an unpleasant but accepted part of school life. In many schools, particularly among older boys, there was a culture of stoicism in which pupils tried not to show any reaction during the punishment. The effectiveness of caning as a disciplinary measure was often attributed to the combination of physical pain, anticipation, embarrassment, and the certainty of receiving the full punishment once it had been ordered. The ritual surrounding the punishment, waiting outside an office, being summoned inside, receiving a lecture, and then bending over to receive the strokes, could be almost as memorable as the caning itself. Former pupils frequently describe hearing the swish of the cane before impact and feeling a sharp, burning line of pain across the buttocks. Depending on the force used, visible marks could remain for several days. Some recall discomfort lasting throughout the day and occasionally into the following day. Looking back, opinions remain divided. Some regard caning as an effective disciplinary tool that taught respect for authority and consequences. Others view it as an unnecessarily harsh practice that belonged to a different era. What most accounts agree upon, however, is that a properly administered caning was a memorable experience that left a lasting impression on those who received it. Ultimately, the sensation of the cane is difficult to convey precisely. While descriptions can explain the mechanics and the effects, the combination of fear, anticipation, pain, and relief afterwards was highly personal. For those who experienced it, it remains one of the most vivid memories of school discipline from a bygone age.